thought it would be great to invite you to be part of the doctor series is that I was looking at what's important for women's health and for understanding women's health. The time you need to spend with a doctor to find out things that you normally don't ask when you go is really important. So the series helps me ask those questions. And whether it's your skin and your face and how you look and your body and how you take care of yourself, a smile is a very important part of how you say who you are and how you present yourself, but also dental health is critically important for overall physical health.
Correct.
So you're a very well-known, famous doctor, dentist in New York, and not in the sense of a dentist, but really as a craft. And so, first of all, tell us a little bit about what it is you do.
Okay, so I've been practicing now at 230 Central Park South in the same office for almost 35 years now. And when I first started working there, it was really 1984. And you graduate dental school and you do a residency, and now you're thrown into the real world. And I ended up in an office with Mark Lowenberg, who had been there for 12 or 13 years before me. And there were no dentists really that were doing something called porcelain veneers. So when somebody had aesthetic work done to their teeth, they were doing composite bonding, which was plastic that you were molding on the teeth. And although it was an improvement, the bonding absorbs stains much quicker than your natural teeth, and it also flakes away and it chips very easily. So it didn't have a great longevity, and it also kind of fell short as far as mimicking the look of what we're born with, natural enamel. But in 1982, 1983, somebody invented something that allowed you for the first time to bond porcelain to enamel as opposed to plastic. And the advantage to the porcelain is that it's very lifelike. It looks like your enamel. It will not stain. It will not wear when you brush it. So we felt that you could get 10 to 20 years longevity on these porcelain veneers. But most dentists wouldn't do them. They were afraid to do them. There was only a handful of offices in the city that were doing them. We were one of them. There might have been 6 or 7 offices, but nobody knew, how are we going to bond these in? What are we going to bond them in with? How much tooth structure are you shaving when you do the veneers? So we would call each other up and just ask each other. And most dentists were pointing fingers at us and saying that, what we were doing was so terrible, because for the first time we were doing some drilling of someone's tooth and putting something on it that there was no study that really showed that would even last the first bite of food.
Oh, you're kidding.
So, but we really believed in them, and it turned out that we were right, because there are cases that I've done 30 years ago that are fine, and 20 years and 25 years ago. There are some people who had it done 10 years, 12 years, 13 years, where we've redone a few of the veneers, but they do last and they do look beautiful. So I feel very strongly, I'm prejudiced because I'm a dentist, but I feel very strongly about the smile being important.
Yeah.
Because I think the mouth is the focal point of one's face. It's always moving when you're speaking. You eat with it, you kiss with it. It's right in everybody's face. And sometimes I'm amazed when I get a patient who, might be a little older but looks great and took care of their skin, and we all go to the gym, we try and stay fit, and we dress well. We're very conscious of how we look, especially as we get older, and especially when you look back at older pictures of yourself, which I just did, which made me very depressed. But you want to look good, and sometimes they come in and then they smile and the teeth are awful. Because what happens as you get older, there's a number of things that happen to the mouth as we get older. One thing that happens is the upper lip loses muscle tone, so it starts to hang lower. So whatever length of tooth you showed before when you speak, you no longer see.
Right.
The second thing that happens is the first two teeth to wear are your front two, which started out the longest.
Oh, really?
Because they're biting first into everything. So your lip is hanging lower, your teeth are becoming shorter, and then the front two teeth become the same length as the next two, which they're not supposed to be. They're supposed to be longer than the two lateral teeth and have a step going up, which is a younger look. So what we want to do is when somebody loses some muscle tone in their lips, sometimes we will build out the veneers just a little bit more by the gum line to help give the lip a little more support, and we give back the length that they've lost from the wear. The second thing that can happen over time is the middle teeth in the back on the sides sometimes will start to come in a little bit. So when you smile and now you have this looser lip, you have dark spaces going back.
Right.
So sometimes we do veneers on those teeth to build out the side teeth wider to create a much nicer arc in the smile and a fuller smile.
Yeah.
But there's no limit to the things that we can do. Some people, I mean, we've all seen them, they give a big laugh and they have a very gummy smile. You see like a lot of gum and these little teeth. So we do a gum lift where the gum specialist, or sometimes I will do with a laser, we raise the gum line and then we make the veneer up to that level. So now you're seeing a longer tooth and less gum when you smile. So it's really an incredible thing because it can so make you look younger, yet you don't look different. Look, I just went to a restaurant, I don't want to name the restaurant in this area, and I just watched as people walked in one after the other. I was with my wife, and it was some poorly done facelifts. You can tell that somebody had something done. The nice thing about veneers, let's say you said, all right, I'm not happy with my smile, I don't like the color of my teeth, I want to refresh my look. So you do veneers. Now let's say you did them, and then let's say 2 weeks later you just said, you know what, I'm sorry, you were right, I should have gone a little less white, or I should have gone a little more white, or I should have put a little more translucency in the veneers to make them more real. You can take them off and you can do another set. But once you have, plastic surgery or a nose job, whatever, it is what it is. So I like that flexibility in doing someone's smile.
Now, I think there's two kinds of dentistry, just like with skincare. Like you want to maintain healthy teeth, and there's health care, teeth care. Let's talk a little bit about that. So what are the routines because I think gum health and teeth and your tongue and everything that's going on have so much to do with gut and heart and everything, and there's many studies, and I've been to several lectures about it where there's a real case on how important hygiene, teeth hygiene, gum hygiene is. So let's talk a little bit about that.
Okay, so your mouth is a very vascular area. You know that when you get your teeth cleaned by the hygienist, there's a lot of bleeding. There's a lot of capillaries and blood vessels in our mouth, in our gums. So
that we can absorb nutrients.
Correct.
Yeah.
At the same time, there's a cesspool of bacteria, normal bacteria, that live in our saliva. It's those bacteria that can turn sugar into decay and eat through your teeth. And there are bacteria by the gums that can cause gum disease. And there's been a number of studies done, many of them. And although they can't prove the exact link, there is no doubt that there is an association between the health of your mouth and the health of the rest of your body. And the reasoning for this is when you have inflammation of the gum tissue, gingivitis, if it's left untreated, it can become periodontitis, where you have a perio condition where you need to really see a periodontist and have your gums cleaned up.
What is a period?
A periodontist is a dentist who specializes in treating the gums. So let's say you had some gingival inflammation. What is that inflammation from? It's from the bacteria that are accumulating around the gum line in your mouth. If you don't remove that plaque, So plaque is really colonies of bacteria, forms constantly in our mouth. That's why we want to brush twice a day, morning and night, to remove the plaque before it calcifies and becomes tartar or calculus. But if that's left underneath the gum tissue between the teeth, you can get periodontal disease. And because the mouth is so vascular, they believe that inflammation in the mouth, those bacteria and that inflammatory process can travel through the blood vessels in your gums and in your mouth to other parts of your body. And so they definitely think there's a link between inflammation in the mouth, whatever. So it's very important, we tell our patients that you have to floss because your toothbrush doesn't get between the teeth.
So what's the best toothbrush? Is it electric toothbrush? Is it a water pick? Is it what's the best? And flossing, what?
So different. Some people are really, really incredible with a hand toothbrush. There are other people that are terrible with it. So if you're really great with using a hand toothbrush, that works wonderful for you.
What do you mean great with?
Okay, so you want to get the bristles up between the tooth and the gum, and in a downward motion on the upper teeth, you're removing the bacteria that are just under that rim of gum, and on the lower teeth, you're brushing up, and you can also massage your gums with the toothbrush as well. The toothpaste is really just to have a good taste in your mouth. I mean, I'm not a big believer in whitening toothpaste. Those don't work. I know that. Anything that's a whitening product has to sit on your teeth for 20 minutes to be effective.
And then there's chemicals in it, and there's stuff that's not.
Right. It's the mechanical removing of this plaque from your teeth to keep the gums healthy. So if someone is one of those people that just does a quick brush and all of a sudden spits out twice, 3 times, feels like their breath is fresh and they're done brushing, for someone like that, it's much better to get like a Sonicare or one of the electric toothbrushes, because that kind of forces you to brush well because it's really doing it for you. And many of them have timers, so you're doing 30 seconds per quadrant, so you're spending 2 minutes brushing your teeth. But any toothbrush, even the best kind, can't get between the teeth where they meet each other, so you have to floss your teeth. A water pick does not blast away the plaque that's between the teeth that floss would get. The only thing that a water pick will do is blast out the food. If you're the type of person that has spaces between your teeth, from your gums receding, and now the roots of the teeth are narrower, so it creates a space where food can accumulate. A lot of people like to use a water pick for that, but it's certainly not a substitute for flossing your teeth. So yes, it's very, very important to have healthy teeth because I do believe it has an effect on the rest of your body. And at the same time, I also think it's important to have a healthy looking smile. There was a study done a long time ago, I remember, and it was like an audience, and they had, 8 or 10 people standing on the stage. They weren't allowed to speak, the people on the stage. They just had a smile. And the audience had a number from 1 to 10 who they thought was the friendliest. They were all smiling. And the people with the whiter, cleaner looking teeth were viewed as being friendlier without ever speaking to anyone in the audience. So it definitely makes an impression, and it's not just an impression like, oh my God, you have beautiful teeth, but it's more so that you just look like you take care of yourself and that you're healthy.
And it also sends a message about how you want people to perceive you. So I spent many years, and I still work with kids in the public schools and high school kids, so they've got their thing happening, and one of the things that I worked hard at doing was talking to them about job interviews and interviews for college or whatever they may be doing, and that they had to smile no matter what. They had to smile, because instead of having this face like this, or smiling, who are you going to respond to? So we would do a thing in the class and just show who would you hire out of these 2 people. One person not smiling, thinking, I got a cool vibe going on here, and the other one being, I'm open and I want to have a conversation. I'm happy. I have a happy approach to life. So that message it works for job interviews, it works for high school kids, it works for anybody who wants to engage another human being.
Right. But there's another interesting thing too. The act of smiling, like that.
Yeah.
When you smile, there are endorphins that are released in your brain. Endorphins are chemicals that make you feel good.
Mm-hmm.
So the more you smile, the more endorphins that are released.
Right.
You actually feel good, so you smile
Yeah.
more, and it's like a cycle. People who are embarrassed of their teeth, and I see it all the time,
Yeah.
and talk like this when they're
Yeah.
talking to you,
Yeah.
or they smile with their lips very low, don't get to experience that. And the fact that you can have veneers done in 2 visits a week apart and just have a beautiful smile, whatever your dream smile is. And I'm not saying, personally, I don't like, that Hollywood Y8, everything is symmetrical. I like translucency here and there. I like little imperfections, things.
Right.
So it's still a white, beautiful smile, but it's possible that you were born with it.
Yeah.
So, that's what we strive for. And I was actually very lucky. 30 years ago, I went to some dental lecture, and it was a lot of dentists in the room. I don't know, it could have been 300 dentists in there, and it was a break, and we all walked out of the auditorium into this lobby where they had refreshments, but they had these little booths set up of people's trying to sell you dental products, drills and burrs and impression materials. But one of the booths said Jason Kim Lab. So I didn't know who Jason Kim was, and we had a guy, even though we were just starting out doing veneers, we had a guy who made very pretty teeth. And as I walked by the booth, he said, I heard of you guys. I know you do more veneers than anyone. Could you just send me one case, and I will show you how great I am? And I said, absolutely. And I took his card and never sent him anyone, because there was no way I wanted to experiment with my patients who were paying all this money to have a nice smile. There's no way I was going to do that. So, and then I kind of forgot about him. And about 6 months later, I was walking in the Greater New York Dental Meeting at the Javits Center, and that's rows and rows of, it's a big convention center where you buy lots of dental stuff. And I turned and bumped into him, and he looked at me, and he just went like this. I said, I know. I said, I know. Listen, I said, I have this patient. She had a very hard life. She just got through cancer treatments. She doesn't have a lot of money. And, a lot of bad things happened to this woman. I said, I want to do something really nice for her. So I'll do a pro bono case, which we do sometimes, just to give her a beautiful smile. And I will send it to you, and you can show me what you do. And anyway, I sent the case to him, and I opened up the box of the veneers, for the day I was going to put them in her mouth. They were so spectacular. I had never seen anything look more real.
Yeah.
So I said, you're my guy. So he opened up a lab on the Upper East Side, and as he grew, and we grew together and learned from each other in this process, eventually he ended up doing work for like 40 different dentists in the city.
Wow.
A year and a half ago, he approached me. He's about my age. And he said, listen, I know you're doing a renovation and an expansion in your office. If you build a lab for me in your office, I will give up all the other dentists and I will be yours exclusively. I cannot tell you.
And you said yes right away.
I said yes right away, and we built this spectacular lab because I have to tell you, when you do a lot of veneers, you also get a lot of dentists from LA who send you their patients when they're in New York, and you get people from Europe who fly in with veneers all the time. I cannot remember the last time I ran out of my room and said to either of my 2 partners, you got to come in and see these veneers, they're beautiful. And that's because nobody, it's an art. Mm-hmm. Nobody can even come close to what this Jason does. His veneer, and everybody knows him. And all the other dentists are freaking out now because he's ours.
Yeah.
So, I just feel like it's important to feel good about yourself, whether you're going on job interviews, you're going on college interviews. How about dating? Mm-hmm. I mean, how do you go on blind dates or you start to date and not just feel, it's I'm nervous when I think about like when I used to date, even though I had very nice hair even then.
But meeting people and the first impression are so critical for so much of what we do in our lives. I also think when I realized that I could do something, that I had a talent for something, and that I could live a life based on that creative talent, for you it's the same. And if you can make people feel good in the process, so what you do is you have taken this artistry basically in a fundamental practice, but created an art form out of it, and take pride in the fact that this is a piece of art that you're putting into somebody's mouth, and that you care so much about that, and that everybody in your office cares tremendously on the result and the artistry of it, is makes for a really great life. Of course, no life is perfect, and we have shit happens, but it really is a testament to your commitment to that you've invested in this, and that you make that, and I think that's a lot to say.
I have to tell you, I feel so blessed to be doing what I'm doing, because I always had that artistic part of my brain, at least on the music side. My dad was a Juilliard professor of clarinet. I studied piano for 10 years. Then I played drums, put myself through school by playing upstate New York in a hotel. So that music art part of my brain is definitely dominant. Cosmetic dentistry is the only area in dentistry where you're really making people happy. No one loves going for a root canal, going for an extraction, having an implant placed. These people come and they spend all this money to have a beautiful smile and 2 quick visits, and then they send you gifts on top of that. It's like it really makes you feel good. And I gotta tell you, I just did a case. 12-and-a-half-year-old boy did the father's veneers. The mother has veneers. He was born with a condition called ameliogenesis imperfecta, which means he was born with no enamel on his teeth. So the teeth are all kind of dark brown and have little pittings in it. He couldn't even brush his teeth because they're so sensitive. So the father said to me, listen, the kid's getting bar mitzvah in July. There's got to be something you can do. For, and some teeth are malformed and whatever. I mean, I never did like a 12-and-a-half-year-old kid, this veneers. So I really had to think about it. So I decided that I would just make some temporaries on his teeth just to kind of show him what it could look like. So I had Jason do this thing called a wax up, so that I could make him these temporaries just for the mother and father and him to see, not even to book anything yet, just to see it. And he was like a really nice kid, and he picked up the mirror, and I said, listen, it's just going to harden on your teeth. They're just temporaries, and then I'm taking them right off. They're not going to stay on. They're going to fall off. But at least we could see if this plan will work. And he picked up the mirror. Norma, I'm telling you, he looked at himself and he said, could I just wear these to school just today, and my mom could bring me right back?
Oh my God.
I could be back here at 4 o'clock and you could take them off. I just want to wear them to school just today.
You can imagine the pain he goes through in school.
So there's really no age limit in feeling good about yourself. And
I remember I was in your office and you had an emergency. Somebody had fallen and really fell badly on their face, and which is not just a cosmetic for enhancing like this little boy, but you have a real emergency of how do you help this person, because how they eat, how they function going forward, and of course then how they look. So it's not the understanding the role of a dentist is very complicated. Basically everybody hates dentists because it's all about pain. Look at the tools you mentioned, burrs and whatever. I was like, what? And so if you can avoid going, you don't go. But when you look at the role or typical day for you, it's all over the place. It's from a little boy like this to somebody fell on their face, to somebody is a famous movie star or model, which they all go to you and then they're going to do whatever, so they need to have whatever enhancement, or people who are just having problems with their teeth as they age or whatever it is. It's so different. It's the complexity of the type of work you do is really amazing to me.
It's really a lot of things, and one thing that we haven't talked about, which is really important. As you get older, from years of eating on your teeth. So this is your upper jaw, and this is your lower teeth, and they come together like this. And this is how you were when you were 15, and now you're 20, and now you're 30. And as you're wearing the teeth down, your upper and lower jaws collapse on each other.
Yeah.
So it gives you an older look, like a saggy look or a sad look. But as the teeth wear down, you lose proper function. And by function, I mean when your lower teeth slide forward and go edge to edge with your upper front two teeth, no other teeth should touch. They're protected in that kind of slide. And when you slide on your canine to the side, no other teeth should touch, because the canine is the strongest tooth in the mouth and has a long root and can support that. So when we eat, it's not like a door hinge. Everyone has different motions. And as your teeth wear, if let's say you wear down your canine teeth, okay? Now when you go to the side, your front teeth are crashing into each other, so they start to wear. And then that wears down, and now something that didn't hit before starts to wear. And it becomes a deterioration of function. And eating properly and being able to eat, is important for your health. And what happens is teeth that aren't supposed to be hit hard are hit hard, roots fracture, you start losing teeth, you start needing implants. So it really, a lack of nutrition is affecting your health too. So it's not just having a beautiful smile. That's great, and that's easy to do for just about anybody. But to recreate a beautiful smile in a way that restores function that was lost throughout that patient's life is critical.
I mean, it's inevitable that your teeth are going to wear out as you get older, and that's just part of the maintenance people have to think about. I think it's critical to do that, but I don't think people think of that as part of what you need to do. As you get older, you do more exercise, you care more about every part of your life, but I don't think that that's one of the tasks on the list of things to do.
No,
and I agree with you. For me, it was really an important part of my health care, for one, but also for the structure of my face. I felt like I wasn't doing, my teeth weren't serving the purpose for me, and it wasn't what the structure of my face needed at the time I went to see you the first time. That was the first thing I said.
Yeah. I mean, I lost a tooth a few years ago. I'd been on something and it fractured in a bad way, so I lost the tooth. So I had an implant put in my jaw, but you can't build a crown or a tooth on that for 4 to 6 months. It was really hard for me to chew on that side with missing just one molar. So I kept sending the food to the other side. What was interesting is when I finally got the tooth back, and it might have been 8 months later, when I had a crown put there, and I started to eat food, that half of my tongue exploded with flavor, like dark chocolate or whatever. I guess I wasn't using that side, so I wasn't using the taste buds on that side of my mouth. My point is, one tooth missing, I had to send all my food to the other side. So when patients come in and they're missing a few back teeth, I don't even know how they eat. It's got to be a lot of work to do that.
This is it's just a dentist question. What's the purpose of wisdom teeth? Like, I don't understand the whole story about wisdom teeth.
Okay, so you have 3 molars in each quadrant. You have your first molar, which you get at 6. You have your second molar, you get at 12. And then most people, by the time they're 18, 19, 20, the wisdom tooth, the third molar, comes up. But what's happened throughout evolution, I guess, because we don't chew grasses anymore like we might have in the caveman days, you don't really need your wisdom teeth to do that. So if someone's jaw is long enough that there's room for the wisdom tooth to come in, then you leave it in there because it's just another tooth
Yeah.
to chew on.
Right.
Or if you ever lost a tooth in front of it, then you can build something off of
Right.
that wisdom tooth. But what I think is happening over time is that some people are being born without wisdom teeth.
What?
Yeah. Like my
No.
wife, yeah, Robin has 3. There was never a 4th there.
Really?
And I keep seeing that. So I'm just wondering if we're on the cusp of a
Wow.
point through
No
evolution
more
where
tail.
there would be no.
Just like no more
Right,
tail.
right. Poor oral surgeons, what are they going to pull out? I don't know.
Wow, that
So,
is really interesting.
but for people who have wisdom teeth, sometimes when the jaw doesn't grow enough, you don't have room for that tooth to erupt. So it's sitting down in your jawbone. In the old days, they used to say, oh, you have to get your wisdom teeth out, like they used to say you have to get your tonsils out.
Yeah.
Now we just say if it's not bothering you, leave it, and if it ever starts bothering you, then you take it out.
And I wonder if people are vegetarians, do you need the fangs if you're like, this is eventually, another evolution? We stop eating meat and then our teeth change.
The fangs are important, so this,
For
someone you
tearing.
really don't like, you just
You
bite
can
into the neck and just rip the artery
Sounds
right
good.
out of it.
You always need
The
your
canines
teeth.
are probably the most important tooth in the mouth.
Really?
Yeah, they do a lot of the, your front teeth bites, sandwiches, things, but the canines where you really go when you want to pull something heavy.
When you want to open a jar.
Yeah, that's always good to do. Beer bottles are good, pen caps, little cellophane things. All that money of people who do those things paid for our renovation.
Right. So tell me about the most challenging beyond patient or case you ever had.
That's a good question. I have to say that after doing this for 35 years, there's not too many things that I haven't seen. Like, that's one thing you have to say about experience. Every dentist knows how to do every procedure. And then when you do a procedure 500 times and you see that it failed in this case, in this case, in this case, but was great in that, you start to learn from your mistakes.
Mm-hmm.
So at this point, there's nothing that really freaks me out. I would say in dentistry, the most challenging thing, besides working on an insane psychotic patient who, every time you see that person's name on your schedule, I just had one, that's why it's fresh in my mind. I'm like, oh my God, she's coming in today. Besides a difficult patient to work on as a patient, when somebody's jaws have, really totally collapsed and you have to open them up, that's probably the most challenging, in that you're doing every tooth in the mouth. You're doing crowns or onlays, which are porcelain overlays on the back teeth. You're doing veneers on the front teeth. But we've so perfected that we can do that in 3 visits now, which is very easy. This child was challenging for me because...
What are you gonna anchor them on if the teeth are so fragile?
The teeth just, if you imagined your teeth and somebody drilled away the enamel and got into that next layer, which is called dentin, which is a darker yellower. So that's a very sensitive surface. That's why, if you had a cavity filled without any injection, as you drill for the enamel, it's fine. You think you're fine for a while, and then all of a sudden it hits a level. That's the level he was born with. So I did have to do some drilling of these teeth in his mouth, and I had to do every tooth in his mouth, because not only did he have this disease, but when he would bite, the only tooth that touched was one tooth in the front, nothing met in the back. I said to him, I don't even know how you're eating. How are you even chewing food in the back? So we had to build everything up with porcelain. So I had to drill these teeth, but there was no enamel, so it almost felt like softer. I had to go really slowly and really carefully to not, if I just would have done my normal pressure with the drill, I could have woofed away an entire tooth. That's how I felt. So I did it very carefully. And, if I wanted to be a pedodontist and work on kids, I would have done that. But, so I didn't know how he would be having 28 teeth drilled in his mouth. And this kid, I guess from seeing what he could
What
look
could
like.
be? He just was gonna
He
grin and bear
was
it.
amazing.
Yeah,
You
I
know.
mean, you were probably gonna end all the bullying and abuse he probably has experienced.
Yeah, you know, his parents, they were both in the room when I inserted it, both filling up with tears.
Mm.
The next day, the mother sent a text, "My heart is full," with a heart. The next day, I got a text from her, "Just dropped a new kid off at school," and there was a video of him smiling at me and waving. I mean, they're little things, but that's how it is, even with patients who just come in to have a nice smile. It's so funny because you do what you do and you're so good at it and it's so easy for you, and after you just know. I can just look at somebody and I know what would work. I've also learned that in a cosmetic consultation to listen very carefully too, because a lot of the things that when we started doing these, like in 1984, 1985, patients didn't know dental terminology. They didn't come in and say, "Listen, I want to have some translucency here and I want you to widen my arch." They know all those terms already. All their friends have been through it. So it's just very different than it was at the beginning. So I listen very, very carefully to what they want. I try and guide them in what I think would look even better. But if I'm feeling that resistance, I no longer fight. Like I had this one guy and he said, "I want the teeth like as white as you can." And I said, "You know what? You really don't. You want to have them white and beautiful, but to look real." And he goes, "No, I really," and it went back and forth. And then he finally said, "Hey, you're not listening, so I'm going to make this clear for you.
Wow.
I want my teeth to go
pow."
Got it? I said, "I got it. I'm going to give you that. Do not tell anyone that I did your teeth, ever." And I did it. And you know what? That was like 20 years ago. He still comes and he still loves them, and I still hate them.
Really?
Yeah. He loves them. Like I can't even look at them.
Really?
Yeah.
Does he have a tan?
Yeah, he's tan on top of it. Yeah.
Wow.
Yeah. So what I take pride in is that I really feel between us and Jason Kim that we customize each smile for that person. Some people's teeth are longer. You don't want to make long, narrow teeth. You want to balance that by having width in the teeth. Someone has a circular round face. You want to give them more length to the teeth. Where their lip sits, what the whites of the eyes look like, what their skin tones look like. If I see someone who sits in the sun, they come in after the summer and they are really, really dark, the contrast of the veneer, the color you pick, to the skin will show how white it is. So if someone is very pale and fair-skinned, they have a bigger range. They can go as white as they want. It's still not going to look that white. So I take pride in, we call it the perfectly imperfect smile. And it should be that way. It should be that people just think you have beautiful teeth.
And are not necessarily thinking that. They're just getting, like you just talked about the eyes, the spacing, the skin tone, that it's a holistic look at the face and not a specific thing. What's your thought about this? Is just a completely off the wall kind of thing, but when you're doing somebody's teeth and they've had a lot of work done on their faces and lips and cheeks and whatever all the process is, how do you work then? Because like you just said, you're talking about someone's proportion, and now a new proportion has been created. So by enhancing someone with dental structure, now you're having a different message because work has been done, and now you have to reimagine the teeth in that new or that face. So how do you look at that holistically?
Well, if someone is going to do work on their face or have their lips done, for us the worst thing is the lips.
I can imagine that must
First
be
of all,
really hard.
You don't even know what it feels like. It's like, to my hands, it doesn't feel like, our lips feel.
Really?
Our lips are soft and
Is it hard?
yeah, it's hard. Sometimes it's hard for us to even retract it out of the way because it's so thick and kind of hard. But what happens is when people have their smile done so that when they speak you can see their teeth,
Right.
and then they go to have the lips done, all of a sudden the lips are gigantic and they're not showing as much tooth because when they smile the lips aren't rising as much. Then they come back to me and they say, you did my teeth and I really love them, but I just don't feel like I'm showing enough tooth. And I'm like, no, you're not showing enough tooth because you've had your lips done since we did your teeth. So if someone is thinking of, doing some augmentation to their lips,
first.
do it first, and then let me build what I'm going to build around that.
And then if they do like other stuff on their face, some cheek stuff, or does that affect?
No,
not as much.
Less. It's the lips that's really
so
the killer.
Proportionately, you wouldn't have a problem with that.
Yeah.
So mainly the lips. I can imagine that might be a problem.
It's a problem. But it's really weird because after doing this for so long, I still get excited every time I have to put one in. Like I can't wait to open the box and see the beauty of Jason's work. I can't wait. I enjoy the process of putting it in, and we're a little different. We have a reflexologist. She's rubbing your feet while I'm working. They're lying back. The TVs are coming out of the ceiling. They're watching a Netflix movie. We're funny, me and the assistant. There's a lot of banter going around, and we make it really fun because I enjoy it. And I could see doing this easily another 15 years because I really love it. So
what's the new technology? I mean, do you see AI or any of the future technology changing? I mean, you just talked about a huge shift from when you started to where you are now as far as the craft of what you do. Every business is affected by a new disruption or new technology. What do you, if you could dream up something that you would like to be the next phase of this, or you see or you've heard of work being done, what's that next frontier for the kind, and I'm not talking about dentistry, I'm talking about what you do.
That's a hard question. The changes that I have seen occurring to date is that the porcelains are much stronger than they were.
Right.
Therefore, they can be made much thinner than they were. Therefore, you can shave a lot less tooth than you would have had to before. There's a new porcelain, it's called Emax. It's so hard that I have trouble even drilling it off someone's tooth, and I have to take off an old crown that's made of Emax or something. So I know it's really, really strong. So we're getting better materials, but the one advance in technology that I don't love is there are these machines, CAD/CAM. So you would take a digital impression of, let's say, a tooth that you drilled for a veneer or for a crown.
Right.
It gets fed into a computer, which gets fed into the machine, and the machine actually starts to mill out to make the tooth right there while you wait. So they say, oh, that's so great. Go out for lunch for 2 hours, come back, we'll have your crown, instead of coming back a week later. It sounds great. But that kind of technology, that crown or that veneer made that way lacks all the beauty and art that you see when porcelain is done the way Jason does it, which is called feldspathic technique, feldspathic porcelain. It's a layering technique. So you can make the inner layers of that thin veneer a little more opaque to give the whiteness. You can build translucency over that. You can create whatever you want. It's like doing a beautiful piece of artwork.
Right.
The CAD/CAM is just milling out something.
And is the CAD/CAM porcelain, or
yeah,
what
it's
material
porcelain.
it is?
It's porcelain.
But I think that it has a great purpose, maybe in a nation that is basically poverty exists in a big way, and there's no dentist to do anything as an art, and having a tooth or
Yeah.
having something like that to get something done is a step better, just like that child, to get something first.
Right.
He would put whatever you put in, he would stay with that
Right.
because you made such a shift. So I think there's probably a place for all
Yeah,
of
there
that
is.
stuff.
You have someone who flies in from Russia. I'm only here for one day. Oh, we can give you a crown on the same
Oh,
day.
you're kidding.
So that would work in that situation.
Interesting.
But from the artistic point of view, for me, it's just I'm not impressed with it. A lot of the dental schools have them there now,
Oh, really?
machines, and they're teaching that technology to the students,
So then
and
who's
that's
going to
great.
learn the artistry?
Well, it's very hard because along with Jason Kim, we have 3 other ceramists that work as a team with him. But it's gotten so busy that we need a 4th, and I keep saying, "Where is the 4th guy?"
Yeah.
And he's like, "You have no idea how hard it is to find somebody that's not only someone who can work with our team, personality-wise, but also someone who's talented, because felspathic porcelain buildup and the layering technique, which is the artistic way to do it, they're not being trained like that anymore.
Wow.
It's just easier, and nobody has the time to do it. It's very, very tedious and time consuming.
It's part of the world we're going into, and like I said, AI can easily take over something like that in time. And for me too, in my business, in schools, there's a dominance of teaching computer pattern making, which is great, and you get fantastic patterns, and they can fit the way you want, they can do everything you want, but there's still a value to that handmade pattern, which is my skill set, where the nuances and something can come out of nothing because you tried a little different, or the fabric went a certain way, or the paper, you did something that said, whoa, this would even look better. And on a computer, you can do some of that, but it's more you are committed to that computer pattern. More students are going to know how to do that computer pattern making because it's so freaking efficient. That for us, we of course have that here too. That pattern gets done, it gets sent right to our factories wherever they are in the world, and that information is there, done, versus the whole handmade process. And so less people are trained, and inevitably fashion will change and the industry will change, and how the clothes people will wear will change. The more that can be done on a computer, the more opportunities there will be what people will wear.
There's advantages to both. As a creative person, I tend to prefer the handmade, the custom made, the artistic part. Taking all of that out of that and just kind of, I mean, I get it, and it has its place, and it's wonderful, but I really respect what you do. I respect, when I look at
anything that has, but anything that somebody put a part of their soul into, you can't match that. You can't touch it. And we appreciate those kinds of things. I think Gen Z, the next generation that I love to death, have a lot of that spirit. They'll reimagine it in a different way, but they have that spirit. So I don't feel it's going to die. It's just going to be in a different way. So you may not be able to pass on forever the artistry that you do now, and the next wave, like your son and people, will come up with another version of it that'll be perfectly fine for that generation. But to have these crafts now, it's very special. And what you do really is unique in a world where people don't really think of artistry all the time. And if you can change the way people feel and make them feel good, which is my goal too, I want people to feel good about themselves. And if you can change a little boy's smile and change everybody's outlook on how they look in the mirror.
Look, with baby boomers, look, we all are getting older, and we all see changes, and you still want to feel good about yourself,
Always.
no matter what age you are.
Yeah, always.
And so, to me, there's no quicker, more easier way to look younger and healthier, and actually be healthier and building and function.
That's
2 visits and done.
That's the key to age in a healthy way. And so if it's oral health or physical health or how you look at the food you eat and your dietary health, all of that makes aging a powerful thing, because you feel good about yourself and you feel good. You're not only the way you look, but how you feel. And so I believe you're absolutely right. If you take care of your oral health and the visible look of how you're taking care of your mouth, it's a tremendous boost to aging with power. And I'm a big believer that aging is not a negative thing, and anti-aging is definitely a negative thing. So what you're doing is saying, look, do this. You're going to feel better. It's better for your oral health, and it's easy.
You know, but it's interesting because some people just aren't aware that they could look better that way.
Yeah.
Like I know you were talking to Dr. Gendler, dermatologist, who's my dermatologist, and I love her to death. She has sent me so many people, because the same people that are seeing her that want to look younger in their skin tone, in their skin.
And they're not wanting to look like they're false. They are not, that's not why they go there. And that's why she thinks dental appearance is in lockstep with her philosophy, which is enhance the positive, don't change it, just make it better.
Exactly.
And that's the real key to aging in a powerful way.
But sometimes you need somebody to point that out for you. So Ellen is one of those people that is not shy. So she'll just say, listen, your skin looks great now. You have to do your teeth. That's how she, you know. There are so many wives who get their teeth done, and then they push their husbands to us, who's at first don't care less about the teeth, but then the wife has the beautiful teeth, and so sometimes it takes a good push, and sometimes you have someone who says, listen, I have this friend who could definitely afford it, and this and that. I just don't know how to tell them.
Well, one of the reasons I thought to do this podcast was because, at 74, I feel there's an
I
audience.
Always forget that. You look like incredible.
Don't forget.
I always forget that.
So if you think about women 40 to my age, there's so much that goes on, and it's the most powerful time in a woman's life. It's the most volatile in a lot of ways, and there's a lot of change that goes on. But it is an incredibly powerful time, especially now for women. And looking like you're trying to hide aging is so detrimental to the power you can have. So if it looks like you're trying to be somebody else, it looks like there's a problem, there's an insecurity, there are issues. But if you're just being the best version of yourself, aging then doesn't become what people see first.
Exactly.
When people do things to hide what's happening to them, it looks like they're insecure and they don't feel good about themselves. So what you do is a process in just, it's a subtle thing, and it's enhancing, and it has so much to do with the structure of their face, their smile, how they present themselves, and that's
But
everything.
they're still them.
They're not, nobody's going to say, oh my God, what did you do? There'll just be something, and
Right.
nobody will quite get it, but you look so much better.
Yeah.
That's really.
Did
that's
you go
really,
away?
yeah.
Your hair is different.
Right.
They can't quite put their finger on it.
But it's something, and then you just feel better. And smiling is so good for you, like you said.
Yeah, it makes you feel good. It makes other people see you in a different light
Right.
sometimes. So
I think that's.
And listen, some people can't afford to do porcelain veneers. There are other things you can
Yeah.
do. You could bleach your teeth. You might have to do it more often if you drink a lot of coffee, tea, red wine, those things. But there's lots of ways to
But
just.
taking care of your teeth is really key. Taking care of your mouth and the health of your mouth has so much to do with the health of your body. So from the vanity part of it to the maintenance of a healthy body, it's really very important. People don't understand that dental health is very critical. So
Yeah.
I hope with this podcast we make sure everybody knows dental health is important, and then the vanity part of it can be a part of how you look at taking care of building up on something that
Right.
might have worn out or
Those
make
two-
you feel better.
Those two things go hand in hand. If you're going to change someone's smile and make them look beautiful, you're checking the function, you're checking the health
Right.
of the gums. I will not veneer somebody's teeth if they come for a consultation until the support, the gum tissue is healthy.
Yeah. And so instead of going on a vacation, you take that money and you invest it in
Yeah,
doing something that's gonna last longer than that vacation.
yeah. Look, you get a really nice car, and you park it in the street, and you walk away from the car, and no one knows it's your car. You walk around with a beautiful smile all day long. You take it with you.
I think that is a great way to end this because we went over our hour easily.
We did?
Yes, we did.
Oh, it seemed like 15
No,
minutes.
but I am so happy that you were able to take the time to do this. I know how busy you are, and I think it's great information to share with a lot of people. So,
Well, I want to thank you for having me because it was a lot of fun, and I almost feel like it was a therapy session. I feel better.
no, I think everybody's going to feel better with,